Uh, My name is Jeff Hill. I'm the director of the Wilson County Substance Prevention Coalition here in Wilson, North Carolina, and here are a few of our community partners that can introduce themselves. Keisha, if you want to go ahead.
My name is Keisha Howell, and I am the Agent Services Specialist at Wilson County Senior Activity Center.
My name is Kayla Ford. I'm the Clinical Affairs Officer for Wilson County EMS.
My name is Ashley Smith. I am the Youth Grant Coordinator for the Wilson County Substance Prevention Coalition.
My name is Doug Green. I'm the Eastern Regional Director of Community Support for Community Impact NC.
Awesome. So we have the opportunity to kind of talk with you guys today about our work as recovery coaches and our work with recovery in general within Wilson County. Our coalition, just to give some background, was originally started at primary prevention in 2007 and over time evolved into much more than that. One of our former directors, to give credit to Ms. Erin Day, noted that recovery and treatment efforts were just as important and such an integral part as well as prevention within our community, which helped us to spawn different initiatives around our recovery center that we're in now, which is RC3, as well as our treatment access point through the Hope Alliance initiative with the Wilson Police Department. But today we want to talk a little bit about one of our educational trainings that we tend to do. We try to do them on an annual basis. One is it's around Recovery Coach Academy. It's teaching community members what it means to interact and to understand what addiction is and how to basically have conversation and how to work with people that may be either seeking recovery or may identify as being in long-term recovery. So what I like to do first is I like to get Doug to kind of start out for us because he does work for a statewide organization, Community Impact NC, who's also held a Recovery Coach Academy. Doug is a recovery coach that's worked in multiple fields. So Doug, I'm going to turn it over to you.
So probably the best thing I can say about being a recovery coach is I do come from a 911 public safety background. And so previously I had CIT training, which is Crisis Intervention Team training, and then to be able to take the Recovery Coach Academy and put on top of my CIT training was great to help folks in crisis and in need, especially during those emergency situations. As a statewide serving organization, where our focus being primary prevention, but we support all areas around substance use disorders, and our secondary focus around recovery and bringing in, really knowing the fact of wrapping recovery back into prevention and really working with those in recovery or entering recovery to help us make a better prevention effort and a better community-wide systemic change and changing policies and advocating for better policies around access to treatment to get into recovery for those that may not have like insurance or even access to get there, like transportation, things like that. And then coming out of recovery and helping them become, champions of recovery, but also champions of prevention. I think it's one of the biggest things I really like about recovery and the whole gamut around substance use disorder field and work.
Awesome. Thank you, Doug. So as you can see, obviously a recovery coach can be used in multiple areas. It's not just one. Every person, every aspect of our lives in some way, shape, form, or fashion can be touched by addiction and the side effects that come with it. And the other thing we can also do is we can say that we can champion recovery in every single aspect of our lives. So one outside of the box thing that you may think is we actually have a leader of our senior center here who is also a trained recovery coach. And so Keisha, if you don't mind, just talking a little bit about what that was like and maybe about how you've been able to put some of that stuff into use at the senior center.
Okay, so my job at the Senior Center is the Agent Services Specialist, and in that job, we work with a lot of seniors and aging adults to find resources that they may need. And one of those services that we provide is in recovery and addiction. We have a lot of seniors who have problems or they've abused alcohol or different drugs. And so we provide those resources, and they're also older, so they have grandchildren who have access to their prescriptions and medications and things like that. So we're fortunate to have the medication lock boxes that we distribute on a regular basis to seniors who come to our center, and also at events that we have for seniors. I took part in the Recovery Coach Academy back in 2018, And during that time, I just learned how important it is to be a support for someone that's in recovery, just very passionate about working with people and guiding them through that process. So the Recovery Coach Academy has helped me because I come from social services where we serve a lot of people who have addictions and mental health, or just a lot of recovery places. And so that has also helped my background. It helped me be able to better advocate and work with the people that we serve on a daily basis.
Awesome, thank you. So, another area that we locally work with our recovery coaches is we actually have what we call a post-overdose response team, which I will let Caleb talk about here in just a second. But what we do is when an overdose event occurs, just to give some basic background, is that EMS gets the opportunity to begin a conversation to also get a release sign that allows a recovery coach to accompany somebody from EMS, either for a home visit or for a phone call. And I don't want to go into too much detail, so Caleb, I will let you kind of talk about the PORT team, just an overview of what it is, and kind of what the mindset for what our recovery coaches are and how we're planning to use them in the future.
Thanks, Jeff. I lead our PORT teams, our EMS PORT team response, and one of the things that we do here in Wilson County is we involve the EMS agency in that post-overdose response. Just because in any community, the EMS agency, for the most part, is going to be that initial public servant that's going to make contact with that individual after they have an opioid overdose event. And by integrating your EMS agency in that and really getting your staff on board with that process, it really gives them an opportunity to have what we call a bedside conversation. And so at the bedside, right after that event has happened, when this person has experienced this opioid overdose event, which very likely could have possibly led to their death, they are critically unstable. For a lot of people that suffer opioid misuse, that's a wake-up call for them. And to have one of our individuals, one of our staff members at that patient's bedside, really starting that conversation. Here's what our community wants to do to help you. Here's what we just did. We care about you. This is not a judgmental conversation. We've given you naloxone. That's not something that has to be a bad thing. Or maybe a bystander has given you naloxone, and we want to start that conversation about what our community's resources are. And I think it really does a good thing for them to see that, EMS, fire, police, it's not our job to have a prosecutorial mindset. We're really there to provide them that assistance. In addition to that conversation, they also distribute what we call the vaults boxes. You may hear them called port kits. Some people call them medication lock boxes. But essentially, in that box, it does a couple of things. First off, it has naloxone. Because any of us that work in the opioid overdose community, that is the life-saving drug. There's a lot of national attention towards that medication. So it has that, and it's concentrated in a form that they can give it as a bystander. They can give it to a friend, a coworker, anyone in that household or in that situation. Because most EMS response is 5 to 7 minutes. If you're not breathing or you're experiencing an opioid overdose, that just might not be enough time for you to actually recover. So we want to get that naloxone in our community. We want to endorse that conversation. The other thing that's in that box is a card that has a community resources. And so our staff review that card with them, tell them what the community resources are, and say, hey, if you're ever in need of someone to talk to, if you want to get follow-up conversation, here's some resources. We have the waiver that Jeff talked about as well that says, with your permission, our post-overdose response team, we're going to follow up with you because as a community, we want to help you. We don't just want to, come here, give you naloxone and take you to the hospital. We really want to bring you into our community's response to the opioid crisis. So that's how our EMS agency is involved. That's how our PORT team works. And one of the ways that we seek to use the recovery coaches is for what we call follow-up visits. And so the initial encounter is, hey, you have an opioid overdose event. EMS is going to come, fire is going to come, police is going to come. We're going to do all those life-saving things. The next step to that is, let's talk about community resources and let's have a follow-up visit. Let's have a face-to-face visit wherever you are, wherever we can come and meet you. Let's bring in those recovery coaches. Let's include the EMS agency as well. And let's continue that conversation about community resources so that we can make sure that they get the help that they need. So that's so far how EMS here in Wilson County, how our post-overdose response team works, and that's what I have.
Perfect. We give a lot of credit to EMS. They thought through even the little things. So the cards that Caleb was talking about are wallet cards. So if you give one to somebody, it's not something that's an open, larger thing. It's very subtle. It's very inconspicuous. And again, it gives that person those resources, and it gives them a way to keep them stored and on them at all times. Because you never know when that light bulb is going to click. So we want to make sure that somebody has what they need when the time is right. But one other area that we also have talked about, discussed here in our community is also youth recovery and youth substance misuse. And so one thing that we did earlier this year was our youth coordinator, Ms. Ashley Smith, was able to go through recovery coach training in November to learn a little bit more about the underlying factors of addiction and how it can affect the brain, not only for the adult, but for the youth area as well. So Ashley, if you don't mind just telling us a little bit about what that was like and kind of how you've incorporated some of that knowledge into the work you're doing around youth prevention in the county.
Okay. So like Jeff said, I had the opportunity to go through the recovery coach training in November of 2020. With the skills that were taught during the training, I've been able to apply it to talking to different community members as well as partners, but it's also helped with facilitating focus groups with youth as well as doing one-on-one interviews. And with that, I've been able to gather a lot of pertinent information that we've been able to use so far in our programming.
Thank you. So a question for my panel before I dive into my experiences with Recovery Coach Academy as well is, I know we talked a little bit about how we use it in our professional life and really how we've integrated these skills into the work that we do on a day-to-day basis. But I also know that at least for me, when we went through our Recovery Coach Academy, it only hits on a personal or professional level, but it hits on a personal level as well. And we tend to grow somehow personally from those kinds of experiences, education, and opportunity. So for the three of you, Doug and Ashley and Keish, that have gone through that Recovery Coach Academy, is there anything, on a not too personal level, but something that you can say that in your everyday life that you now put into action thanks to kind of that common knowledge or that understanding that you may have gotten thanks to that Recovery Coach training?
So one thing that I will say is that I really focus now on using better language that's not stereotypical, and that has been pretty significant in talking with different people.
I think for me is we, in the substance use disorder work field, we always talk about resilience and, building resilience in youth and young adults that, potentially have, family members, mom or dad, or, older people that they look up to in their family that have had substance use disorders. We always talk about resilience with them and building their resilience and building community resilience. And I think for me, with the Recovery Coach Academy plus my CIT training, it actually helped build resilience within myself. And things that I've had to deal with in my life in my younger years that were probably not the best decisions, but they helped create who I am today, and some of those lived experience, things that I can talk about with youth and young adults and other people that relate. I think that's probably one of the biggest things is, we all have certain things we go through on a daily basis, crisis in ourselves. That could be from, your Starbucks coffee, they got it wrong, just ruined your Monday, or, to something even more serious, like I'm not sure how I'm gonna pay the bills this week. But Recovery Coach Academy and having that training and really diving into those personal needs, I think really helps you work through those internally so you can continue to move forward and progress and be successful.
I would agree with Doug. I think that the same applies for working with aging and senior adults. Just knowing that different situations occur, but the things that we were taught in the academy help to be able to help them and I guess understand where they're coming from a little bit more, and just continue to help them to work through whatever issues they're going through, whether it be substance abuse or within themselves or with their children.
And I think too, Recovery Coach Academy, I'm a very big proponent and for anybody to take it, but it also, it's called Recovery Coach Academy, and of course it's basis around substance use disorder, but it dives so deep into around mental health
Yes.
and things like that. And a lot of times especially from the professional field. I can't, you know, I previously worked in, sometimes we get jaded and forget about that mental health side and how it relates to substance use, and it really helps you dive deep into that, to have those personal conversations with people in crisis, or, you know, maybe they've gotten to a point in their life that they want to seek treatment or recovery, and they need that person to talk to and talk it out with. I think it really helps build you those skills needed to do it.
Awesome. And Caleb, just another quick question. Just from our interactions that we've had with calls and our first interaction today with our visit, we talked about a little bit, you and I, about how EMS is there to really give the information on Narcan, the medical aid pieces, where the recovery coach is really that community resource, that down-to-earth personal piece. Is there anything from the EMS perspective about that personal piece that makes it so important during those conversations to have that on top of that professional medical piece to really make that relatable to somebody?
Yeah, absolutely. So on the EMS side of things, you know, we really look at opioid misuse and even opioid overdose events probably differently than recovery coaches. You know, as in the middle of that event, my thought process is, let me treat life threats and let me revive and resuscitate this person. Let's prevent a cardiac arrest. It really is trying to reverse the physiologic effects of the opioid overdose event. And often it's really after that initial encounter that you really start to think about all of the personal implications that led to this event. And I think, like Doug said, it's easy for medical providers to just become jaded that, you know, aside from the physiologic effects of it, you know, this person may suffer from a mental illness. They may have had an injury where they were prescribed opioids. You know, all these other personal things may have occurred that led to that day, that led to that event. And I think really including the recovery coaches in those conversations really does bring that personal piece. Someone who may have a lived experience, someone who may see the other side of what happens after that opioid event. Often EMS providers, we're with these individuals for 30 minutes to an hour. We don't see the days and weeks before the overdose event, and we don't see the days and weeks afterwards. And so I think including the recovery coaches in those conversations really does help make that encounter relatable.
Awesome. Awesome. Thank you. So that just goes to show a few examples that not only is recovery coaching important in our field that we work in with primary prevention, treatment, and recovery, but in so many different aspects of our life, whether that be in the medical or even day-to-day interaction. The biggest thing that I'd like to say too with our community is you can see how diverse our recovery coaches is, and that's done strategically. We want to make sure that we have these resources in every single aspect, nook and cranny, to where somebody, if they're in need, can access someone like a Keisha or a Caleb or an Ashley or a Doug. And we've talked about things from the senior center, from the medical perspective, from the youth perspective, and even on the state level. But when I was trained as a recovery coach, I actually was trained before I came into my position here at the Coalition. I was working for a federal reentry grant that served 18 to 24-year-old youth here in Wilson County. And one thing that became a highlight from my recovery coach training that I learned is that even on grant level, to where there's funding that's supplied for workforce development and other soft skills training, that substance misuse is so easily overlooked. A lot of it can be considered quote-unquote commonplace based on different things that I've seen, but in reality for us in the county, we know it's a high priority. So by going through recovery coach training, even though I was only a year into my work, it changed my perspective as far as the people that I worked with. It made me understand that there was so many different behavioral patterns outside of their control that may have led them to misuse. There may be a mental health diagnosis, as was discussed earlier, that may have led to it. It could have been something that truthfully they were given by a parent and told was commonplace. Because here in Wilson we do have intergenerational use, and I'll openly admit that. For us, recovery coach training is not only gaining perspective, but it's changing perspective. And it's getting people to be open and honest about a subject that 9 times out of 10, especially in rural communities like ours, tends to be a closed-door conversation. But by having these academies and having these champions in the community, it allows that door to open, whether it be by a toenail or by a kneecap, to where now this information is open air. Now these conversations can happen. Now there are people that are available to talk through things, to get you to places that you need to be. It's okay to talk about an NA meeting or an AA meeting, but it's not okay to talk about the suffering, the substance that you're suffering from. And that's the common language that we're trying to change. The other piece is the stigma. And I do want to harp on that because everything that we do, there's always a piece around stigma reduction with it. Because whether it's recovery, treatment, or prevention, and that can go all the way from MAT to basic preventative measures within a school system. 9 times out of 10, if it has something to do with substance use disorder, somebody's not going to like it because they don't like the language or they don't think that it's their problem. And for us having recovery coaches in so many different areas coming from so many different backgrounds, it shows that it touches everyone. And again, that is a piece that just allows us to say, hey, this is something that transpires, but it's also preventable, and if it's not prevented, it's treatable. And that recovery too is possible. And then it allows us to use our people in recovery, our recovery community, to show the champions that really recovery makes out of other human beings. We're advocates, we're here to support our community, but most importantly, we're here to be a resource. And I'm very thankful for us here in Wilson County that we have such great people that are willing to sit at the table, that are willing to share this knowledge, and that are willing to be that resource for the people that need it the most. Talking about bringing things to the county and kind of making these resources available, I can kind of talk a little bit more about what we've done with Wilson, but from a state level and being able to offer it to multiple counties at one time. Doug, I know that you guys held a Recovery Coach Academy back in November of last year. Can you kind of talk about how you guys made that work and kind of what that process was like?
Yeah, so one of the biggest things that I always recommend about those that want to bring Recovery Coach Academy to your community is to partner with other communities, because the cost is a little bit high, but what you get out of it will pay for itself in the long run. And, you know, helping break that cost down between multiple counties or municipalities or, you know, managed care organizations and stuff like that, to bring that training is really key. So, and the cool thing about the training now is with the pandemic and post-pandemic and stuff is that they are able to do it in person or virtual. So if you did partner with multiple counties to bring Recovery Coach Academy to your local communities, that you could have people spread out and they don't have to worry about, you know, travel costs and if they need to stay overnight or, you know, it's an hour one way for them and then an all-day training kind of thing. So those are just a couple of ideas about how you can get it to your community.
Awesome. And for community level, specifically to speaking towards Wilson, when we've done our Recovery Coach Academies, we've worked through the AHEC system. Area LAHEC is our provider. Debbie and her team do a tremendous job of getting everything set up. And really all we had to do was contact them and tell them what we wanted. And they took care of everything on the back end, sent us an invoice and said, is this good? And we said, absolutely. And it was up to us to do the recruitment. So for us, it could be something as simple as reaching out to a local AHEC provider or somebody like that, or for a state level deal, it could be cooperating between multiple counties. Obviously, things also depend on funding streams if there's limitations that go with that. I have to say that out loud. But I can tell you that a lot of the funding, at least that we work with, tends to be flexible on different things like that because they do understand the importance of what we're trying to offer.